Morning, good afternoon to my co-host Rose Hoy. My name is Dr. Tova Goldfein. This is TMS Roundtable Global. It's a special show. We usually stream at 2200 Israel time, and Rose has to get up at 5 a.m. in the morning. But today she's joining us in her afternoon, and it's morning for us and our special guest, and Rose will introduce him now.
Good afternoon, everyone. Thank you, Tova. Today we've got Simon Vulfsons. He is, I suppose, the director of a program called Touch the Pain in Israel. He's also the help me,
Director.
the Musculoskeletal Medicine Society director, which is an international program, and he is the medical director of the pain clinic in Rambam in Israel.
Yeah. Beautiful.
Rambam. Sorry, I've got the pronunciation wrong, folks. Dr. Vulfsons actually lived in Australia once, and for any Australian viewers, he's a Carlton supporter. So
strong Carlton supporter.
Yes.
We just lost half of our audience.
No, you probably gained a whole heap.
No, anyway, it's actually living in misery. To be a Carlton supporter is to live in misery. That's something else.
Anyway, what Dr. Vulfsons is going to actually allow us to have a look inside a pain clinic, see the multidisciplinary group that helps people overcome their pain. He has actually traveled the world in regard to this. He has an intimate knowledge of hypnotherapy, what else? Shiatsu, hypnosis, etc. So he brings a whole range of ancillary medicine to the table. He may not actually physically use it when he's seeing patients, but he's got a cognitional sort of understanding of what's going on. And I loved how he said to us the other day when we were speaking to him, if it's an obscure diagnosis, it's chronic pain or somatic pain or TMS, however you want to approach it. And I thought that's the way that all our medical professionals could look at it and see and hone in on the patient's problem rather than send them to various doctors and various diagnoses. So thank you so much for coming on board and offering your wonderful skills to our audience. So maybe give us a little bit of a background about how you got involved with this and share that with us. And then hopefully we may get some questions about people's somatic pain and we can address that. Thank you.
Well, I'll tell you the story of why I'm dealing with pain. I went to medical school in Jerusalem at the Hadassah Medical School. It's considered the most, but at the time it was the most prestigious. Sorry, I'm moving away from the picture. Most prestigious medical school in Israel at the time, and I was gung-ho and ready to cut and chop anything and everything. My father was an orthopedic surgeon, and I was sure that I was going to do orthopedics or surgery or plastic surgery or something. You know, I was one of these Errol Flynn guys with a knife between my teeth and just ready to cut and chop.
It's another kind of touching the pain. Different kind of touching
different way to touch the pain, and it's and so on. And that's how I imagined myself as a medical student and so on. But at the end of my internship, an Israeli internship is different from the American one. It's similar more to the Australian. It's a rotating internship where you go to various different departments. And although I'd been accepted for residency, I wasn't happy, and I didn't know why. I just did not know why I was not happy, because I'd got everything I wanted, and I wasn't happy. Just so. On the spur of the moment, basically, I said to my wife, let's pack up and go traveling, and we'll see what happens afterwards. So we did. We packed up, we sold everything, and we went traveling. And it was 18 months. We traveled for 18 months. We went to the Far East. This was in 1986. 1986. We came back in 1988. And it was in the Far East that I started to develop severe backache. I've been a very active in sports. I played rugby, which is it's a
Very physical game.
Very physical contact sport. I played for the Jerusalem team, the Jerusalem University team, for the Israeli team, and so on. So I was used to, knocks and stuff, but I developed a severe backache. And it got to the state where I'd been to see physicians in the Philippines, in Thailand, in God knows where. They'd done various x-rays on me, and then somebody suggested I go back to Israel and do a CT at the time. And so on. I was sure that I had something very serious. But I was lucky to meet an elderly woman at a Thai massage, traditional Thai massage clinic in the center of Bangkok, and one treatment and I was cured. Completely. I mean, that's a whole story in itself. I'm not going to go into that. But I realized suddenly after that, I remember getting up off the bed and the backache's gone. And now I know. Obviously, I had, well, maybe I had tension myositis syndrome, but maybe I just had crooked my back. As a chiropractor will say, maybe you've got a crook back and you need somebody to straighten it out. I don't know. But anyway, got off the table, said to my wife, I'm really angry at my medical school. They never told me that this existed. They never told me that there's such a thing.
That's the diagnosis. You released
so
the feeling.
Angry that they had not told me about this. I said, I'm going to study this, and then I'll see what happens. So we continued traveling, got to Australia. I did a course in shiatsu in Australia. There's no Thai massage to be studied at the time in Sydney. Got back to Israel. Told my father, orthopedic surgeon, I'm not starting residency. I'm going to go and learn shiatsu and acupuncture. He tore what little hair he had out of his skull. But I did. And then I also decided at the same time, well, I might as well complement it with something from the mind. So I learned hypnosis. And with these three skills, shiatsu, acupuncture, and hypnosis, and in the meantime, I did odd jobs. I realized it's time to go and study again to actually become a real doctor, not just a GP, but somebody who's got a specialty. And thinking about it long and hard, I went into internal medicine. Very different from the knife between my teeth that I'd had before. And from internal medicine, at the same time, luckily, 1993. My previous boss from the pain clinic arrived back in Israel. He was looking for people to help him in the pain clinic. He turned to me. We hadn't met before. He said, "Come and work in the pain clinic." And I said, "Well, I don't know anything about pain." He said, "That doesn't matter. You do the acupuncture. I'll teach you pain." And that's it. That's the story. The rest is all, finished the residency, and I stayed in pain, and so I'm in pain.
You're in pain now all the time.
I'm not in pain personally.
Well, you understand your patients, that's for sure. You can relate to your patients.
I was lucky. I was cured, but a lot of my patients aren't cured, unfortunately.
So how do you think you were, just regarding your story, how do you think you were, the massage worked on you so efficiently? Because not always massage is so efficient. You had a very quick release of tension.
I've got no idea, but there was I don't know if it was a mind-body thing, to be very honest. I've got no idea. I got on the bed on this little wooden, there's this low wooden massage bed, and she was a tiny woman. She 5 foot, maybe 50, 60 years old. I've got no idea, but she had fingers like iron rods, and there wasn't a point on my body that she didn't, a painful point that she missed. She got everything. It was excruciatingly painful. The treatment itself. It was obviously trigger point therapy or something like that. She manipulated my spine at some stage, which is also an interesting experience. I'm not sure. I really don't know, but I'm not. I think I'm sorry to tell you that I think it was more physical than emotional. But the truth is, I got better, and I decided to move my whole focus in life to dealing with people suffering from pain. So I can't honestly tell you that I think it was a huge emotional experience, but I've come to acknowledge the emotional part of pain.
Yeah. And now in your clinic, I believe you have a multidisciplinary team.
Yeah, we've got a huge team, to be quite honest. We're the largest in the country. We've got 5 senior physicians, 8 residents who are specializing in pain. We've got 5 psychologists, something like 8 physical therapists, some chiropractors, some osteopaths, some physiotherapists, nurses, social worker, so on. So it's a large screen. I think they're altogether, 45 members on staff, not all of them full-time, some of them part-time, but we've got, 45 members on staff.
How many patients would you have, like a month or per annum? Or, I mean,
we have about 25,000 visits a year. That's about 2,000 a month. And we see about 5,500 patients a year. Unfortunately, only about 1,000 are new patients. The same that occurs the world over with pain clinics is that a lot of patients get to the pain clinic, they suddenly find people who listen to them and understand them, and they don't want to move. And whether you can cure them or help them or what, they don't want to move. And so a lot of patients are reluctant to go through whatever they're going through and then go back to their family doctor, because they realize that the family doctor or the community medicine is not going to help them. And it's a huge problem, because it means that basically our capacity is much larger than what we're actually using, and it's an ongoing struggle. It's a terrible thing to tell a patient, we can't help you anymore, you have to leave us.
It would be.
It's a terrible.
Now, when you set up the Touch the Pain group, that was for doctors, wasn't it?
Yeah, it's something entirely different. In 1998 to 2000, approximately between 20 and 25 years, a group of physicians in Israel got together and started talking about what we call musculoskeletal medicine. It was very much a body thing. Actually, the doctor who really was the major pusher from Melbourne, her name is, she's a family doctor, her name is Osnat Wendy. She's now a pain specialist in Jerusalem. And she and a few others, I was one of them, we got together. This had already been 10 years since I got back from that trip overseas, and I've become very interested in the musculoskeletal aspect. And we established the Israeli Society for Musculoskeletal Medicine. Okay, backache, neckache, shoulder pain, etc., etc. And during the first few years of developing the society, it's a professional society. It's not a financial establishment. It's a professional society. During the years, we started hearing more and more and more. We would discuss this. People would say, "Oh, you've touched my pain. Oh, you found my pain. Oh, you're the first person to ever touch me." And
I love it.
And I realized that touching patients, probing, testing, and so on and so forth. And then I had the background of shiatsu. So in shiatsu, the background is you learn how to touch. Doctors don't learn how to touch. Doctors are hopeless at touching. Absolutely hopeless. They've got no idea how to touch.
Do you hear that out there, doctors?
I'm sorry to say, they've never learned. Go and do a course in shiatsu or tuina or any of the oriental massage, and you'll learn how to touch. You'll learn what the body can give you. And actually, this is something I developed very early when I was a resident in internal medicine. And I used to find amazing things that other people couldn't find just because I knew how to touch better. But anyway, so and then suddenly you find that patients respond to your touch, not to what you're saying or it's a certain thing to do with the touch. And then one day I said, well, we had a logo, which I never liked. I didn't design it. We decided to rebrand ourselves with a different logo. And the logo is actually a hand touching. That's the logo. And then I thought, well, we should write down there, touching the pain. And that's where it started. So it's the logo of the Israeli Musculoskeletal Society.
I want to make a point that you mentioned a few times in your in your last couple of sentences, and I may be sensitive to this word because I am, a body worker, and I've taken shiatsu, and it's quite amazing, and all the massage courses, and being a chiropractor, and now being into the body mind part of that. It's there's always an emotional piece. Someone's always having pain. I mean, I'm using the word always, but there's an emotional reaction to their pain, to their disease. It's scary. It's uncomfortable. They're dealing with their mortality. So there's always a connection. And the beautiful thing is that the doctor just knows that. I mean, if it was their own daughter, the doctor would know it. If it was themselves. So what you've been doing is complementing that service of being the doctor and saying, wow, it must be scary. Or like Rose has taught me, like, what's going on in your life right now as you got the disease, you got the cancer diagnosis, you have the pain, you have the, I've spoken, so long story short, you've already said the connection's there, whether we notice it or not. What's beautiful about you being a doctor is you're saying, hey, let's talk about this and let's see where it hurts. And the patient feels safe and comfortable. And then you see a whole nother part of that patient.
Well, you have to be careful. You honestly have to be careful. As well as disorders, it's not really used today, but people still say psychosomatic, although I'm not really sure that terminology actually applies today, but it's also somatopsychic. So it's the other way around, I've had patients who I've touched, held their shoulder or whatever, and they burst out crying, and you ask yourself, well, what's happening here? Why? What's going on? But you do have to be careful with this connection, because yes, I think that every patient has got a cognition. Okay, now we're not people who are in coma or demented, but every other patient has got an illness or a disorder which affects the body, affects the mind. I've never seen a patient walk into my clinic without their mind. It hasn't happened. They always bring their mind with them, whether they're aware of it or not. They do.
Well, that's the point, isn't it?
That's what I say to patients. I say, look, they say, well, you think I'm crazy? I said, no, of course I don't think you're crazy. I think you're a person. Otherwise, if you can't walk in here and leave your mind and emotions at home. It doesn't exist, doesn't work. So let's discuss that. I had a week ago, two or 3 weeks ago, an elderly couple were referred to me. The wife was referred to me. She's a aunt of one of the physicians working in my hospital, and he wanted me to see her because she's going through terrible anguish and so on. And they came in and they were really, really distressed, both of them, terribly distressed, very confused. The taking the history was very confusing because they were jumping back and forward between a shoulder that she'd fractured, but that doesn't hurt, and the other shoulder hurts, and that's been hurting now for 3 weeks, but she suffered for 5 years, and back and forth, and I realized there was severe distress going on. And what is it? I'm not sure. Anyway, slowly, and then they suddenly said, well, we came to you because we want you to prescribe cannabis, which is a big problem here. Any of my international, in Israel, everybody knows, but anybody here from the international audience who's listening, bad news, cannabis, bad news. I'm telling you, you don't want to know how bad cannabis is affecting what's happening in Israel at the moment. But anyway, they wanted cannabis. Well, I directed them to the door. I said, well, that's the door, and out you go. I'm not interested, but if you want a consultation, you're welcome. And eventually I was able to take the history, I was able to examine her, and we sat down and I said to them, the amount of distress that you're displaying and the amount of distress that you are showing me is far in exaggeration from the physical attributes that you have to your pain. Okay? Your examination's basically almost normal and so on. So what's going on? And then she said, well, my husband's had a huge surgery last year. He had a cancer. They weren't able to take it out completely. And so I asked, well, how are you doing? And he said, well, I'm doing fine. I feel good. I said, how old are you? He said, well, I'm 85. I said, oh, okay. So let's put this let's put this one to rest quickly. I said, listen, you're 3 years older than the life expectancy of a male in Israel. In other words, every morning you wake up in the morning and you're still here, you should have a big smile on your face, put a tick on the wall and say, I just won it again. Okay? You're 3 years older, you're older than your life expectancy. This cancer is not going to kill you. You're going to die with the cancer. You're not going to die from the cancer. So forget about it. Completely useless time and effort to worry about it. You don't need to. He was actually very amused. The junior physicians in my department were horrified, but he was amused.
Let's call that talkless, like talkless.
Sorry?
First of all, we're going to have another show talking about how people live longer here in Israel because we're just happier people, but that's beside the point.
Well,
that's off cannabis.
But I said, but that's not the story.
I know.
Give me the real story. Give me what are you suffering from? And then she told me she lost one of her sons in the first Lebanese war, which is 1982, and she's never got over it.
Yeah.
And then we started talking about that. And the fact that she lost her son, one of her sons, and who he had been friends with, etc., etc. And I said, have you never been to therapy, the two of you? Have you never gone to speak to anybody? They said, no, we thought that we were strong enough to get over it by ourselves. I said, okay, well, it's almost 40 years ago, but go. Right. Now's the time to go because this is your pain. Right. This is what's causing your pain, right. Not the little bit of niggling that you've got on your shoulder or on your lower back and so on. So it was very interesting. I have to follow up. I haven't followed up.
Send them to Dr. Sivoni in your hospital.
Well, I mentioned that.
Yeah.
I did mention that.
Yeah.
Yeah. Somebody's writing somebody.
Yeah. I'm gonna. It's one of our fans from Australia.
Queensland.
But before I bring up her question, I want to ask you one important.
Dr. Simone Vulfsons, you have to get rid of the E. It's Simon.
Really?
Absolutely.
Oh, I'm going to do that right now. Hold on.
Simon, not Simone.
It's not Simon.
although I must tell you that I'm named after a Simone.
Wow. But I'll get rid of that right now. Hold on.
Who was from France, and he was killed in the Holocaust.
But his name was Simone.
That's where I got my name from.
Okay, I'm glad you told me that. I want to ask you a very important question because the reason why I contacted you and begged Ronnie to ask you to be on the show, like I begged him. Your friend Ronnie, the physical therapist in the hospital from the Netherlands, what a great guy! And Ronnie, yeah,
good friend.
Coconut, great guy. Yeah. We're going to have him on our show, Rose. He's just a delightful guy and physical therapist, really seeing mind bodies. He looks at people and he understands like you. So, but my first attraction to who you were, and before I even knew you were involved with Howard Schubiner and some of the people in our world.
Sorry, let me, the automatically in my room, the light goes off if I don't move. It's coming back.
Yeah. So I was very, very attracted to the fact that you chose to write the foreword for Dr. Sarno's book, Healing Back Pain, which happens to be in 30 languages. So, 30 languages, which is really amazing. And you chose to write the foreword in the Hebrew version. And Rose and I in the audience would love to hear more about why you chose that and what you wrote in it. And, why you took your time and energy to be part of that book, which lots of people know here and lots of people read here. It's a very, very well.
Actually, the introduction is not to Healing Backache, it's to the MindBody Prescription.
To the MindBody Prescription.
But, when I first started working in pain and dealing with patients suffering from pain, obviously backache is one of the most prominent complaints. One of the previous bosses of my clinic, and actually the person who started the clinic in 1965, Professor Jesmond Birkan, very, very, very special Irishman, gave me the book, Healing Backache. He said, you should read this. It'll be interesting for you. And I did. And I found it fascinating and interesting. I had a lot of thoughts about the physiology. Obviously, being a doctor, I was interested in the physiology aspect of what he says. I've done a large circle around that throughout the years, but okay, I understood it. And I remember giving it to a friend of mine. He was actually a patient, but he lives very close to me, and we became friendly over the years. And he used to come in constantly suffering from backache. And then one day I said to him, David, he's American. I said to him, David, read this. Take this, go home, read it, bring it back to me. And he came back a week later. He said, my backache's cured. I said, cured, completely cured.
Another saved by Sarno.
Completely. Actually, I saw him recently. He's 72, 73, still very active. I saw him at the pool a week ago or 2 weeks ago, and he said, "Oh, I had a Sarno experience last week." I said, "Why? What happened?" He said, "It's really severe backache." Then I suddenly said, "Okay, let's see what Sarno has to say." We opened the book, read a couple of chapters. So by the time I finished the chapters, it was gone again, and so that convinced me that Sarno was onto something. And then I started looking for TMS. Started looking for it actively and so on, and finding it. And then started suggesting it to patients. Now, the interesting thing is, and Sarno writes that, I think, in Healing Backache, he says, I have a very, very high cure rate for those patients who are prepared to accept my paradigm. So only those patients who are prepared to accept my thoughts and ideas about it are going to get better. Others are not going to get better. It's not going to help them. They have to be convinced that there is a mind-body connection. And then they can understand the connection and they can go on and get better. And that was my major criticism that I wrote in the introduction. I said, it's a wonderful, wonderful treatment. It's a wonderful way to get better for those that are prepared to accept the fact that there is a mind-body connection. Unfortunately, there are a lot of patients who are fixed and fixated on their physical attributes. And until you overcome that, they can't get it. I've got a patient now I've been treating, and she's a lovely lady, 35, 40. She deals in cosmetics. She does a lot of work on the face and so on and so forth. She's developed shoulder pain. I'm convinced it is TMS. Convinced. She's not prepared to accept it, and she keeps going back to, well, the orthopod sent me for an MRI, and the MRI showed this and showed that and so on. Nothing that I've done for her, and by the way, I sent it to Tzivoni, Dr. Amir Tzivoni. He gave up after a couple of sessions. He said, she's not there. She's not there. She's not ready yet. Okay, so she's not ready. So what we have to do now is make sure we don't harm her. If you can't cure her, at least let's not harm her. So I see one of my most important chores is keeping patients away from doctors who have a knife between their teeth.
You can relate to that personality.
Yeah, you can't cure everybody. Some patients are not ready for the cure.
Right.
They're not ready for it.
How do you keep them away from opioids then?
I tell them I'm not going to give them opioids. What they do with their life is I don't give them opioids. And I tell them.
Yeah, but don't they ask for it?
Sometimes. Yeah.
Yeah.
The doctor doesn't have to do everything a patient says. I often tell patients I'm not prepared.
Sure.
They come in asking for cannabis, and I tell them no.
Right, but there is a lot of science now with the psychophysio, association. There's enormous amount of science for those patients who don't want to believe, because it's hard for them to believe their physical pain is coming from an emotional cause, because it is physical.
Well, it's so easy to explain and to show, but some patients don't want it. That's why I've become very interested in something called ACT therapy or ACT therapy, which is acceptance and commitment therapy. And the acceptance part of it is understanding and being prepared to accept that this is where you are, and the commitment to actually do something about it. And one of the major problems with patients is what we call fusion. fusion with ideas. So you're fused with an idea. You're fused with the thought that the accident you had 10 years ago is the cause of all your pain and all your problems. You're fused with the idea that you have a extruded or protruded disc in your back, and that's causing your pain, and you'll never get better. You're fused with the idea that, somebody said you've got degenerative changes, and you're sure that degeneration means you're going to fall apart like the Roman Empire, etc., etc. And you have to defuse the patient, and until you defuse them, sometimes you just can't do everything. You can't do anything.
Yeah.
Well, very good point.
They're having this sense that I'm hopeless, haven't they? There's no hope from. They have a sense of not having any hope, don't they? It's going to be the same as it was in the past. Yeah.
Tamar Meisel.
Yeah.
Isn't that true about every treatment? You have to believe that it'll work? Absolutely, Tamar. Yeah. Absolutely, of course.
Yeah.
Well, if you go into surgery believing that surgery is the solution for your problem, you have a much higher success rate. If you go into surgery believing that this isn't for you, but you're doing it because, I don't know, your parents thought it was the most important thing, then you're going to have a lower success rate, of course. Yes, belief. There's a wonderful book written by, what was his name? Called The Power of,
The Power of Now, The Biology of Belief.
The Biology of Belief. That's
well, because belief is chemical. Can you say that on air? Can we get that on recording? Belief is chemical. Will you agree? Gratitude is chemical. Love is chemical. Hope is chemical. Can you chat about that for our audience? Because it is chemical. In honor of Norman Cousins, who laughed his way to cure, laughing is chemical.
Well, Norman Cousins also had a huge influence on me. I read Norman Cousins when I was in medical school, and he had a huge influence on me. And that book that he writes,
Anatomy of an Illness.
Anatomy of Illness, was had a huge impact. And the story that he tells about laughing his way through illness to health.
I mean, this is chemical. If I go into surgery and I have this positive sense, this calming, this will work, that changes all my adrenaline, my serotonin. I mean, I love talking about that. And I wish I had a lifetime to study psychoimmunology, which is something that, is another big, I don't want to get you off your topic. I want to answer Cheryl's question as well. But before, Cheryl is such an amazing Saved by Sarno story. And she's down in Queensland, but I would like to ask you to speak about, I don't want to forget to ask you to speak about your experience with Lorimer Moseley.
My experience with Lorimer Moseley?
You went down to his conference with Ronnie, and I want you to talk about your experience with him. He's a wonderful pain.
Well, first of all, there's three things I like about Lorimer Moseley. First of all, he started off as a physiotherapist, not as a doctor. And he's probably one of the senior researchers in the world in the field of pain.
Wow.
Probably, yes. He's considered one of the senior. Second thing I like about Lorimer Moseley, he's got a brilliant sense of humor. Absolutely brilliant.
Especially walking in the forest and a snake bites his foot.
Not in the forest, he was in the bush. The bush is not the forest. The bush in Australia is
right.
not the forest.
Thank you for that detail. The bush.
The bush, in the outback. He was in the bush. And he's got a wonderful sense of humor. He is hysterical, absolutely hysterical. And he comes over with a very, very, very broad Australian, really broad Australian accent, right? And he's in Adelaide, Flinders University. And my brother went to Flinders University. I wasn't old enough before we left Australia, went to Flinders University. And that's where I come from South Australia. So these three things together, and of course, he's brilliant. He works with a guy called Butler, and they've written Explained Pain and so on. And I wanted to hear him. What's the big deal? You take a flight, you go to Holland, spend a hotel 2 days, and you listen to him, and it was great. And he's got I don't know if you've been to his lecture. If you've ever been to his lecture anywhere, he's so innovative.
It's on YouTube. If any viewers are interested in watching, he's got quite a few on YouTube.
There are lots of lectures on YouTube, but yeah. So I went to listen to him. I loved it. I had a great time.
Can we, Rose and I wanted him on our show, but of course he wanted to charge us a lot of money. But maybe we can bring him to Israel to talk.
Lorimer Moseley will not come to Israel.
Uh-oh.
Been there, done that.
Okay. Let's
He won't
not
come
go
because
there.
his wife thinks it's very dangerous.
Oh, okay.
Oh, it's so safe here, isn't it, Rose? It's so safe here.
That's what he said. So he won't come. But maybe he'll come online. Who knows? We'll see.
Much safer than Philadelphia. Let's. I want to introduce you to
That's
Cheryl,
well said.
who's a wonderful patient of ours and will be helping us doing some teaching because she's got a great Saved by Sarno story. But this is her question. Do you think the energy healing through the hands of the Thai therapists, as that type of energy can feel and transfer so much? This is from her past experience a couple times of massage. The right massage person, of course, one who is in touch with healing. And she's talking a little bit more about the therapist. Yeah.
Yeah, I do less now. But when I was doing shiatsu, that was a long time ago, but when I was doing shiatsu, you could feel a connection. You see, intimacy occurs, or touching people occurs legitimately in only two circumstances. This was taught to me by my shiatsu teacher. The first circumstance is when you're intimate with somebody, okay? And it's legitimate to touch. The second is if you are in a healing process, it's legitimate to touch. Otherwise, it's not legitimate. It's illegitimate, completely. You cannot just walk up to somebody and touch them. It's not acceptable. Can't be done. So if you're touching a patient, it has to be obviously in the context, and it has to be appropriate, and then it's definitely legitimate. Now, the transfer of energy, I've been through that whole thing. I really have. I even studied Reiki. I even did Reiki 1, Reiki 2.
Wow.
After Reiki 2, I said, this is enough. I've understood, or I've felt what I think is there. And
Reiki doesn't touch. Reiki, we don't touch.
Reiki, you don't touch. It's true, but
the skin.
I know. Yeah, you don't touch, but there's this idea of a transfer of energy and so on. I don't know. I'm a doctor. I'm a little bit square. I'm a little bit, I'm
You're
not sure
allopathic with a touch of complimentary.
I'm a little bit more allopathic than, I don't know. Maybe. I don't know. I just know that I like touching, and patients usually like being touched, and maybe it conveys a sense of security, a sense of confidence, a sense that somebody cares about you, and maybe that's part of the healing process. I'm not sure.
Oh, absolutely. Well, it would be, wouldn't it?
Yeah.
Just think of a child being held. I mean, the comfort of that resonates through our whole lives, doesn't it?
Yeah.
And Rose's work, her ISTDP work, she brought on a wonderful psychiatrist from Canada who was teaching psychologists about ISTDP and about the relationship between the doctor and the patient, which is so important. And you haven't mentioned that, but how important is that relationship, psychologically and emotionally?
I think it's very important. I think I work in a public clinic. Okay, I don't work privately. I did work privately in the past. I haven't for over a decade worked privately. And working in a public establishment, patients don't get to choose. They don't get to choose, and it's not as if you're going to a private doctor and you can say, well, I want to go to this one, and you're going to sign up and go and see your doctor and so on. So every once in a while, there'll be a patient who's not happy with what you're doing. Has come for an agenda, a specific agenda, and so on. They're not happy. And it's happened over over periods of time that patients have been very upset because they've not been prepared to accept what my opinion is or what my ideas are. And I've said to patients over the years, I've said, listen, this is what I believe in. This is what I think. And it's fine if you're not happy with it. Go find somebody else. That's perfectly all right. I'm not going to be offended in any way. And I found invariably that these kind of patients are not going to do well on what I suggest. So the patient-physician communication and so on is very important. What I have learned over the years is to stand up for what I believe in, and not to say, well, that's fine, go somewhere else, go to somebody else, go see somebody else. But don't try and manipulate me to do what you think is your agenda. That I'm not prepared to do that. I'm prepared to be fair, to give you my honest opinion, and you have to live with that. You have to either accept me or don't accept me. That's fine, whatever.
Would you say that those patients are coming to defeat you?
I don't know if they're coming to defeat me. I think everybody's got an agenda. Everybody comes to
Is that the agenda? Do you think that's the agenda?
Well, so sometimes the agenda is, doctor, I really need help. Help me. I'm not saying the agenda is a bad thing, but everybody comes to a doctor or comes to a therapist for a reason. Okay, they're not feeling well, but sometimes the reason is not really clear. I remember having this patient for a long time. He had severe pain in his foot, something called CRPS, which is a severe pain condition. Terrible and it happened through a work accident. Well, some of these patients slowly get better. And it did. Over time, he got better. Over a year, 2 years, 3 years, he slowly got better. He was able to walk again, and he was better. And he still kept coming. And I said to him, well, why are you coming? He said, well, and the agenda changes. So the agenda at the beginning was help me with my pain. Now the agenda is write me a letter for Social Security. Now the agenda is I need Social Security benefits, etc., and you have to write me a letter. So I said, okay, this is the last time we meet. This is the last time. I'll write you your letter. You're better physically. You're better with your CRPS, but I'm not going to be here to write letters for you. I'm sorry. It's not me. I've got better things to do with my time to treat patients who are still suffering from pain and so on. He was very upset. And he said, well, how can you do that? You've been my doctor for so long. I said, I have, and you're better. What do you want now? You're better. Your agenda at the time is fine. Your agenda at the moment is not fine. Not for me. Not for me. You want to, look, basically, what are you doing now? You're coming to see me because I am your tool to get money. That's how you're going to get money. You're going to get money by using a letter that I'm writing. I said, well...
But if he's well, how would he get Social Security if he's well?
Also true. That's another conundrum. But if he wants to get Social Security benefits and it's all about money, go pay a doctor privately who writes these kind of recommendations. Somebody else should also enjoy a cut of your profits. It's not me. I'm not going to be there. So agendas. So I've got a very close friend. He's an orthopedic surgeon in Israel. He's a very special orthopedic surgeon. He really is, because he doesn't believe that most surgeries are necessary. He's very special. And he says to me, there are 3 important questions that every physician has to ask himself or herself at every meeting with patients. Is it urgent? Okay, so you examine the patient, whatever the story is it urgent? Does it need to be dealt with now? Okay, is it important? Sometimes it's not important. And what does the patient want? Those are the 3 questions. So anybody out there listening, ask the 3 questions. Is it urgent? Is it important? And what does the patient want? And that goes to Dr. Ronnie Feinstein. Okay, I'm crediting Ronnie Feinstein.
Amazing.
Very close friend of mine.
Amazing. I think all surgeons, I think all doctors are listen, things are changing. Cannabis, no cannabis, corona, no corona. Things are changing. And that's the purpose of our show, is to help people see that we're not against, Rose and I are not against medicine. Rose is a nurse for 40 years and a midwife. I mean, we're not against medicine. We're about integrating and getting people well, having them take responsibility. And that's what you're saying. It's like, it's time to take responsibility to the man with the Social Security, to the person getting surgery. Is like the times are different. And doctors like you are saying, please help me heal you. I can't do it alone.
Well, I'll give you a nice story about that, and that also involves Ronnie Coconut, the physiotherapist. So we work in a multidisciplinary clinic, and I saw a patient suffering from severe shoulder pain. A young guy, 30 or something, and the pain came on after he's an engineer. He fell at a construction site, dislocated his shoulder, there was a dislocation, a fracture, and so on. It was all put back together. He's a young guy, did physiotherapy, but he suffered from chronic pain. Okay. So that's a basic story. So the idea was, okay, you've got a problem with dysfunction with your shoulder, go see the physiotherapist. So Ronnie saw him. So Ronnie saw the patient. Now, right next to Ronnie's room in the clinic sits the psychologist, the head psychologist. And sometimes they can hear what's going on in the two rooms, which is not great, but it can happen. Anyway, so Ronnie's treating this guy and wants to know more about what's happening and more about himself. And again, this is a PTSD story, because what happened was when he fell at the construction site, he was stuck there for a couple of hours by himself, and he got into terrible anxiety. But this was based on a previous story, again, where Israel army, combat, etc. I think in the second Lebanon War in 2000, I can't remember exactly. He had, or no, it was after that. I don't know. One of the combat episodes. He'd been in a platoon, and a lot of his mates, a lot of his friends in the platoon were injured, and the head, the platoon commander was killed. It was his best friend, killed in front of his eyes. And he remembers being stuck in this place, and they couldn't move for a couple of hours. They were pinned down. And this came up. It went, all came up. So you've got the previous trauma, you've got the recent trauma, hadn't been treated, and it all came up together. And the psychologist was right next door. Ronnie went in to her and said, listen, I need you now. I need you, not, she was doing some paperwork. I need you now. So she came in and heard the story. They set up a few sessions. Wasn't a lot of sessions, because the guy's basically, a few sessions and
cleared it up.
Well, he was able to work through it.
Yeah.
And so this is a multidisciplinary. This is the pleasure for me of working in a clinic like we have, where you've got a physician who does a basic workup and looks and sees is it important, is it urgent, etc. Refers to who he thinks is necessary.
Appropriate.
Our clinic is open, so the physiotherapist can speak to the psychologist and say, listen, I need your help here. It's urgent. In this case, it was urgent. It was not only important, but it was urgent, and so on. And that's the pleasure of working together in a multidisciplinary environment. You're not just by yourself in a clinic and you say, oh, we need to go and see a psychologist, make an appointment. No. This is here and now, which is fun. So that...
Dr. Simon, when we were speaking to him earlier on, gave us many, many examples of exactly that, of being aware of how pain can affect your disposition, I suppose. And, he gave us an example of a young woman who was in chronic pain, and yet when she went to the grandparents' place, the pain ceased. And
I know. I've decided not to go into that story, but I'll tell you another one.
Yeah. No, but just the fact that she went away from her environment changed her mental disposition, and that, out of that, the pain ceased while she was away from her family. Isn't that how it worked? Something like that.
Well,
Yeah.
yeah. Well, her
Yeah.
her story was far more complicated. But as we
Oh,
discussed
yeah.
the other day,
Yeah.
I don't want to go into it.
No,
What
no,
I
that's
will do is I'll
fine.
tell you an interesting story that again I had
Yeah.
many years ago. This is when I was doing a lot of hypnotherapy, and a woman, I think she was in her early 40s, was referred to me by a family doctor, very, very respected and well-known doctor who we all knew did everything possible for his patients, did the workup, never missed anything, really good doctor. And he said, listen, she's got chronic abdominal pain. Nobody knows why. We've done everything, CTs and ultrasound and gastroscopies and colonoscopies, etc. And we don't know what she's suffering from. Can you treat her? And so she came to me already prepared. She's going to undergo hypnotherapy. Undergoing hypnotherapy is I don't really like the terminology, but basically it means can we find a way to relieve your pain, and is there a connection maybe to the subconscious and so on? And there are various ways to do that. And we talked. Obviously, the first session is an intake where you go extensively into the history and so on. I said, and one of the things was, well, has anything happened, in your past recent life or past life that you think could be associated with your pain? And she said, well, there's only one story, but I really don't believe it is. I had an affair with a younger man living very close to where I live. It was torrid, exciting, etc. But after a month or two, I realized this is very dangerous for my marriage, etc., etc., and I broke it off. And that's all. Yeah, it was wonderful. It was a wonderful, exciting experience, and it was enough for me. And that's it. And I didn't want any more. There was no problem for him either, and we finished it. And I'm back to normal married life, etc., etc. And I don't think it's associated or connected whatsoever. Okay, fine, good. So I noted down. I say, okay, I'm not going to. You obviously don't want to go into it. I'm not going to go into it. But then so in one of the sessions, I said, okay, we're gonna do something interesting. We're going to connect to your unconscious or your subconscious. And we're going to connect your subconscious in a way that basically your subconscious is going to communicate directly to me. And you can either be aware or not be aware. And you do this by inviting her or requesting that you go into a very mild trance, hypnotic trance. Doesn't have to be very deep. And you ask questions of the subconscious directly, and the subconscious answers you through finger signals. You raise your thumb if it's a yes, raise your index finger if it's a no, raise both of them if you don't know or you don't want to answer, and you ask various questions back and forth. There's a technique to do this. I remember spending a weekend learning how to do this technique. And the nice thing about it is you don't have to know. You just have to ask the subconscious, is it associated with you? You don't have to know the whole story. So I remember, okay, you've got this pain, the subconscious, are you happy to answer me a few questions about the pain? Subconscious answers yes. And she doesn't know what's going on. She's in a trance. She's somewhere else. Okay, so do you think that your pain is associated with the affair that you had? And she answers yes. I said, are you prepared, or are you prepared at this time to make the fact that you think it's associated with your pain, to make it not subconscious, but to bring it to awareness? And the answer is no. So, that's interesting. So the subconscious wants to keep this information, that believes that the pain's associated with this affair, but doesn't want to bring it to awareness. So then I said, okay, that's fine. Are you prepared to decrease the amount of pain? You don't have to get rid of it completely, just decrease it. So it's really not bothering, but it's there. Subconscious says yes. I said, are you prepared to accept the fact that when you don't need this pain anymore, you'll just release it? Subconscious says yes. I said, okay. Do you want to keep all this very secret from yourself and from everybody else? Subconscious says yes. Saying thumb up. I said, okay, good. Let's come out of the trance. She didn't remember anything, absolutely nothing. She did not know what we talked about. And I was in touch with her 6 weeks later. The pain had decreased with a tiny twinge every once in a while, just to remind her. She didn't know why. And that's it. And then I saw him years afterwards by chance, and the pain had gone away. So this is a classic TMS. Classic. And it was very interesting to work with her, especially using this technique. But the subconscious has the ability to store trauma or guilt or anger. Sarno talks about rage, all the rage.
How about grief?
Yeah, fear, and all this. And the subconscious can store all this stuff, and it has to express itself. And either you're aware of it or you're not aware of it. Very often people are not aware of it. They're just not aware. And they keep on having this pain. Very interesting.
Wow.
Well, the body, that Bessel van der Kolk program, the body keeps the score.
Yeah.
It virtually says, the body can't speak, but it can tell you that there's something going on, doesn't it? Yeah.
Well, I think so. I'm very aware. When I see patients, I want to understand. I really want to understand the whole story. What's going on? It's for me. Every new patient is like. I don't like crossword puzzles. I like Sudoku. It's like a brand new Sudoku. Okay. This is exciting. Let's see how. So let's
connect the dots. Let's connect.
It's a puzzle, and I find that very exciting. Every new patient for me is very exciting.
Absolutely. Yeah.
It's like,
and they're all different. Everything's the same, and yet everything's different.
Well, we're going for an adventure. Let's go for an adventure. And I laugh.
And you're together with your patient. That's the beauty.
I laugh a lot. I laugh with my patients all the time. I if they say something funny, something comes to my head or to my mind, I laugh, and I'm not really very politically correct, to be quite honest.
What Australian is?
I walk a very, very thin line. And so,
well, you're well trained living in Australia for that.
Well, the nice thing about being my age is I say, well, you can't fire me anymore. Close to retirement. It's firing me is not on the books.
I know Rose has a client in a few minutes, and I would just like to put this out. I'd like you to come on once a month, and we could just talk about amazing cases that you're healing, and we could help the world. We could heal the world together. Think about it. With your 25th hour in the day.
I think that. No, not once a month, but once in a while. But what I'm more interested in is hearing.
Simon, she wants to be a Dr. Phil.
People onto the show that would tell either their story or somebody else's story, and then we can.
That'd be lovely.
That I know. I've got stories to tell. I'm like an old dodger telling people stories. It really doesn't. I'd be far more interested in hearing a story and discussing it.
Yeah. Well, we had 80 shows of amazing stories of Saved by Sarno stories that would just rock your socks. So I know you don't have time to listen to our YouTube, but we will bring you on with maybe a person who has a story, and we can, talk about that, or we'll bring some more questions, but we would love to have you back. And this is Margaret from Australia, from Melbourne. And we're really happy.
Hi, Margaret from Melbourne.
It was an off time for our show because we usually go in the evening, but thank you so much for joining us. Just really, really grateful for your time, and always love hanging out with Rose on the Be Live on our cyberspace. So Dr. Simon Vulfson, have a wonderful day. Rest of the day. Rose, I love you dearly. I'll talk to you later because we have work to do. And thank you again so much.
Okay, thank you very much.
Bye-bye, everyone.
Okay, you guys can go, but before I leave, I'm going to sign off with our theme song and a few words from Michael Golinski and ourselves. So I'm going to put that up, but thank you. Have a great day.
Okay.
Bye.
My name is Michael Golinski, and I'm a filmmaker. I've made a film about Dr. John Sarno and his mind-body approach to medicine. And in the course of taking that film around the world, I met Rose Hoey in Australia and Dr. Tova Goldfein in Israel. And together, we decided to pool our resources and work together to spread the message of mind-body medicine.
So I'm Dr. Tova Goldfein, and I've had the privilege of helping many, many people in chronic pain and with autoimmune disease take responsibility and live a quality life. And like Michael, I've had the privilege of studying Dr. John Sarno's methods, along with many other doctors that have taken the methods a step further. The movie All the Rage is a blessing, is a mitzvah, and it has helped thousands of people manage and come out of chronic pain.
My name is Rose Hoey. I'm an ISTDP psychotherapist and a registered nurse, and I have the wonderful privilege of spending time with patients, helping them to see what they don't want to see, the issues that have hurt them for so long. We are doing this show because we know that you can heal too.
Exactly. So together, weekly, we come on with therapists and doctors and movie producers and people that have self-healed from chronic disease and from chronic pain and autoimmune disease. And we hope to continue weekly meeting you and educating you and helping you self-heal.